Hello, this is Rahul Patil here, your health coach from My Genetic Nutrition. Today we are going to discuss about insulin resistance and how insulin resistance is present in most of the population, and insulin resistance leads to most of the diseases. But unfortunately, most of us are not aware that we are insulin resistant. So let's see how it is experienced by different type of people. So you see over here these two individuals. One is overweight, about 250 pounds, that's about roughly 125 kgs or 120 kgs, and the other person is about 155 pounds, that's about roughly 70 kgs. But what is the common factor between these two people? One is obese and one is thin. Both have 33% body fat. The individual on the right hand side, the thin person, is in fact at more risk because that person does not know that he is fat from inside. The person on the left side at least knows that there is something wrong with that person and he or she needs to exercise or change the food that person is eating. But the person on the right hand side who is thin, also known as TOFI, that is thin on outside, fat on inside, is a person at more of a risk because that person has no idea why he or she is experiencing certain health problems. So we need to be very, very careful with people who are thin and are fat from inside. So there are three tests which will tell you whether you are fat from inside. Of those three tests, I will discuss at the end of the video. So let's go to the next slide and see how women experiencing fat or being obese are experiencing today, what symptoms they can be experiencing. First is uh, because of insulin resistance, a female can experience high testosterone levels, and this female you would see normally is little bigger on the upper body above the waist and and has thin legs. Can also have that extra hair on the face. The face can be big, and the personality can be little aggressive. So this is what can insulin resistance or high insulin lead to in certain females, which will be high testosterone. The lady in the center is obese and is struggling to lose weight all her life. She's tried several diets, she's been exercising a lot day and night, but nothing has given her the kind of results she is expecting. But the root at which the problem is again insulin resistance. The third lady on the right hand side, on the extreme right in the blue color, she is experiencing polycystic ovarian syndrome. She has fertility issues and she is again a victim of having insulin resistance or high levels of insulin in the body. So in females there can be different results, but the root cause or the underlying root cause can be insulin resistance. So we need to be very careful and address this root cause by eating the correct food. What are the other conditions that are associated with insulin resistance? Non-alcoholic fatty liver, which is again very commonly present in today's population, is also a result of insulin resistance. Gallbladder issues, again because of lack of fat in the diet, and high intake of carbohydrates also gives rise to gallbladder disease. It can lead to gallbladder stones. It can also lead to indigestion and digestion disorders in people having gallbladder disease, because the bile juice which comes out of the gallbladder is responsible for breaking down the proteins and the fat that you eat. Gynecological disorders or abnormalities, as we discussed earlier, like PCOS or other disorders, are also because of insulin resistance. Osteoarthritis, which is an inflammatory condition, is again the underlying root cause is insulin resistance. Cancer, which is a progressive disease which takes years to come, and nowadays you're finding in young people cancer, again the root at which is insulin resistance. It has been found that the cancer cells on the tumors or wherever the cancer cells are growing are highly receptive to the glucose that we eat. Glucose comes from all the carbohydrate that we eat, and the cancer cells have something called the insulin receptors which grab this glucose in your bloodstream and multiply. So it's very, very, very important that the people experiencing cancer watch about what they eat, watch the percentage of carbohydrates then in their diet, which is going to help them either slow down the process of the cancer or stop the cancer. The other things that can be happening because of insulin resistance is diabetes. Diabetes is very, very common, and India is one of the leading countries in diabetes and the associated diseases because of diabetes. But the root at which at all these diseases is something which is hiding behind all the diseases is insulin resistance. And this is what we need to really look after, aim at resolving by nothing but food. Food is medicine, and food is something that is going to help you reverse this condition called insulin resistance. All these diseases come under an umbrella called metabolic syndrome. Your diabetes, coronary artery disease, non-alcoholic fatty liver, dyslipidemia. Dyslipidemia also is a result of insulin resistance. In dyslipidemia, you have low HDL, that is good cholesterol, that again puts you at a risk of heart disease. And you have high LDL, one of the particles in LDL which basically is very, very small and dense, and which can again settle down in your arteries and congest your arteries. Cataracts is another side effect of having insulin resistance and diabetes. So you got to be really careful of what you put inside your body. So your food is your medicine, and your food is the toxin if you eat the wrong food. Insulin resistance can lead to, visually if you see, something like this. This is the kind of a body type that a person has who has insulin resistance. See, you can see a typical, this kind of person relies more on the junk food. Also, darkening of skin is found in people who have insulin resistance. It's very important that if you have darkened skin around your neck, you immediately start doing something to reverse insulin resistance. Skin tags on the neck or on the body anywhere is also a part of being insulin resistant. Skin tags, if you see, what you can see here, is not a part of aging, but it is a part of being insulin resistant person. This is also something, some skin growth on the fingers, which is again a type of skin tagging, is also a result of insulin resistance, lack of good cholesterol, and lack of vitamin D3, K2, and other essential micronutrients. So you got to see really what you're eating and balance it out. Solution for insulin resistance lies in food as medicine, and the approach always should be evidence-based. So the three tests I discussed earlier are HbA1c, fasting insulin, and postprandial insulin. If you don't understand these tests, you can get in touch with us. Wait for the email at the end of the video. Change what you eat. Insulin resistance leads to carbohydrate intolerance. Consult a nutritionist and calculate your carbohydrate tolerance and daily carb allowance. It's important to understand how much carbs can your body tolerate and how much you're allowed to eat daily. Exercise. High intensity interval training and strength training is a proven method to improve your insulin sensitivity, and that should be at least a part of your weekly program 2 to 3 times. Avoid fructose in any types. Fruits will give you fructose, high fructose corn syrup, plain sugar, honey, jaggery, dry fruits. Read the ingredients of all the processed food that you buy off the shelf, because most of the sugar or the sweeteners have high fructose corn syrup. Your plain sugar, 50% of your plain sugar also has fructose. So avoid fructose in any form. Very, very important if you want to reverse your insulin resistant condition. Fifth, start doing intermittent fasting immediately, because that is something we all have forgotten. Fasting today has become somewhere like today people fast and they end up eating a lot of food that is supposed to be eaten during fast. So I don't understand what kind of fast is that. Fasting should be purely fasting, no food, only water. So do these 5 things and start your journey to reverse your insulin resistance and get some solutions to your existing health conditions. So this is the KIIC program of My Genetic Nutrition. It's a nutrition-based plan aimed at reversing diabetes and obesity. We use food as medicine, and our contact is mygeneticnutrition@gmail.com. So if you have any health issues, get in touch with us. This is Rahul Patil, your health coach, signing off. Thank you so much for attending this small video.